It is no longer possible to do what we have done in this country for years, look the other way, or to anecdotally explain it as some aberration or yes, we do have a problem, but it's really not that bad. I think this year proved that it actually is as bad as we've been telling folks for a long time. And so I think one of the reasons we should be hopeful is that I do believe that we are in a situation where white Americans are willing to accept what we Black and brown folks have known for a very long time, and that is that racism is real and it is imbued in all of our institutions, and most prominently, it is instantiated in our healthcare system. So,
Absolutely.
how do you, when you talk to our white brothers and sisters who are on the journey, how do we talk about this issue of the inequity in healthcare?
Well, not only is racism real, it's still with us. It's not something that we can talk about in the past tense. It's still here. And I think we're having a moment similar to the fire hoses that were turned on Black protesters that was televised across the country, where people got to see firsthand what racism looked like. We've seen it with the murders, and we're now seeing it with the impact of COVID. One of my sons wrote a letter to his school, and in the letter he said, if you care about the murder of George Floyd, you should care about the people who are dying every day from COVID. You should care about the people who are dying every day from diabetes, because they don't have access to quality health care, and they live in communities that lack resources. So I think that shining a light on reality is the first step, so that people can actually become aware of what people in our country are living with, and then turning the awareness and anger into determination to change and sharing a vision for change, and then helping to lead the way toward that vision.
And what would you say, as the person at the helm of this really critically important signature community hospital, what would you say to those policymakers to get them to move to do the things you know they need to do?
We have a separate and unequal health system, and the lack of access to quality health care is killing minorities in this country. I feel both angry and frustrated that we have tolerated these conditions for so long, but a part of me is hopeful that we do have a window of opportunity to make some progress.
I'm reminded of my favorite poet, Langston Hughes, and his poem in the 1930s called Let America Be America Again. And the first stanza starts, Let America be America again. America never was America to me. And he ends, however, with the last stanza, which says, oh, but yes, one day America will be. And so Hughes was voicing both the rage that you were just talking about, you feel, with hope in a belief that this country would live up to its ideals and do what it has never done, which is deliver on that promissory note Dr. King spoke of in his great speech. And so for me, living, yes, I have lived without privilege. I certainly grew up in a circumstance without privilege, but I live as an adult in this city with enormous privilege. And so for me, there is no time to wallow. Every day, all of us who are Black or brown or different, we have to suit up every day. There is no day off for us. And so I consider it a privilege to have the honor of leading the Ford Foundation and serving this institution and its mission. We are in the business of hope at the Ford Foundation. I have no reason to be anything but hopeful. Even during these dark days, there is still light. And I'm looking at some of that light right now and celebrating you and the Dream Show and the work of the Martin Luther King Hospital and what it does in this community. The message that you send out of hope, of justice, and of belief in what is possible when a community comes together with a great board, a great leader, that real transformation can happen.
Thank you. We are in the same business of hope and of pushing for change. And yes, we know that America will become America again because we're not going to let it do anything else.